Starting Thursday, there won't be any capacity limits for businesses requiring proof of vaccination, like restaurants, gyms, sports arenas, and concert venues will be open at 50% capacity. With me now is Dr. Peter Juni. He's a professor of epidemiology and medicine at the University of Toronto and the scientific director of Ontario's COVID-19 Science Advisory Table. Dr. Juni, good morning. Good to see you.
Good morning. Good to see you too.
Let's begin with your reaction to the news we heard from Doug Ford yesterday. I guess we can break it down, beginning with the end of the vaccine passport program.
Yeah, I think there we had two possibilities. One was to basically change the definition for vaccine certificates from a 2 to 3 doses as a requirement for a certificate. But there the problem is we needed to account for people who have had an infection recently, and 2 doses plus an infection would need to be equivalent to 3 doses. And this was very challenging. You know, how is this feasible right now if we have a challenge with our testing system, not enough testing capacity, etc. So this was not an issue. So if you stick with 2 doses, then we just need to acknowledge that somebody who has had 2 doses has about the same risk of infection, not of serious outcomes, but of infection, as somebody who is not vaccinated, meaning the passport or certificate that then isn't really viable anymore. So 2 possibilities, either 3 doses or lift it. Lift it is probably the right decision right now, not to make it a tokenism, and to have this continuously in our back pocket. If it's needed again, perhaps in autumn, one never knows.
Okay, and then let's talk about the capacity limits in restaurants, bars, cinemas, gyms. Going to be lifted this Thursday. Too soon? On time? On pace with what we're seeing with the level of transmission? What do you think?
I believe it's supported by data. You know, we were looking very carefully at our wastewater surveillance program in the province, which is really representative of what goes on in the entire Ontario. And when you look at that on our dashboard, the concentration of virus in wastewater, it really continues to decrease. And we haven't reached the bottom of the valley, the trough yet, which is good news. We could reach it now, of course, when we do the next reopening step. But this means, because that's a leading indicator, that hospital occupancy and ICU occupancy will still go down, even if we reach the bottom of the valley for wastewater. And you can expect that we will probably make it below 1,000 hospital beds occupied, and perhaps at around 250 ICU beds occupied before we reach the bottom of the valley for these 2 parameters, meaning we're on the right track. We just need to be careful. We have a variation in the province. Today we will start to show wastewater data for regions in Ontario on our dashboard of the science table. And you will see, for instance, that the north is still struggling and that there was some variation, that some peaks came later than others in the province.
All right. And I know this is largely a federal matter, but I'm curious to know what you think about this call for travel restrictions to be lifted. Do you see this happening anytime soon? Do you think that Canadians still should be getting a PCR test before they come back to Canada?
No, look, the times are changing. And the point is that we have so many people everywhere worldwide who get infected that we struggle with this long tail of potential detection. So if you are positive, you have had an infection, it could be that 2 weeks later, even though you're not infectious anymore, you still have a positive PCR test. And, it could happen. People like me, I might go to London or so in the UK, and then I'm stuck there. I had an infection perhaps, but I'm not infectious anymore. But my PCR will still say, okay, there's viral material there. So we need to find pragmatic solutions. And this means now that we just acknowledge a lot of people get infected. This is Omicron. That's not what we had previously. And then just start to think about good ways of surveillance, that we understand when there's a new variant coming, that we can do something. And this also perhaps means that we have some ways of, random samples at the border, but it's not related to any restrictions. And the other part is, of course, in certain situations, rapid tests could be helpful as long as we see their limitations.
Okay, and one final question. What we didn't hear changing were the mask mandates. Dr. Juni, how long do you think that they will be in effect? How long will we need to wear masks?
I can't tell you yet. What we need to be aware of is that this is a really easy measure that doesn't impede our societal activity, our economy, and it can be very helpful right now in the situation we're in. So the point is, we now need to see that's the next dramatic step of reopening. How does this actually all play out? And depending on that, and depending on the weather, we can do that sooner or later. But it's very difficult without the crystal ball and pixie dust, actually, just to figure out when this could be.
If we all had pixie dust, that would be very helpful, wouldn't it, Dr. Juni?
It would. This virus is humbling and it always has another curveball. But I really believe that we're right now in a good spot. So let's move on. Just let's do it carefully. Also means for people, please continue to take it slow, not too fast, just stepwisely.
Okay, if you're saying we're in a good spot, that means a lot. Dr. Juni, I've been pressing you on that for a year. Thank you so much. Good to see you. We'll talk to you again soon, no doubt.
Good to see you too.